The day is bright, the day is clear, it's a happy day. Here in Nigeria, it's a lovely morning. And what a way to start your day by tuning into Tea or Coffee on High Impact Television Station, your number one first full HD TV. And also, I have many things to let you know today. We have different things for you to know. It's Wellness Wednesday. It's Wellness Wednesday, where we talk to you about your health and everything that has to do with your health. I am Wura Olakpopola, your Wakanda princess. And with me, I have my Wakanda queen.
My name is Ronke Ashiru. You're welcome. You are the one with all that lightning kind of thing.
Wakanda. Good to see you today. How are you doing?
Yes, very, very fine.
How was yesterday for you?
Nice.
Oh,
nice.
I love your top. It's nice.
Yeah,
The lady. Am
I
I going to call you Lady in Red?
She's sitting beside you.
Okay, I'm not aware about that. Maybe we should sign you to one of our record label, or what do you think?
Yes, no.
Oh.
I'm dropping.
So what do you have for us?
How many months you'll be my producer?
Do I want to be producer? No, I think I want to direct, I need to put things right because your voice, I don't know, I'm not saying, but I think it needs training or sort of.
You can't bust my bubble.
No,
you can't.
Okay, let's try something. Let's just do something simple. The day is bright and clear. Oh, happy day. The day. No, you're the one singing. I'm the one directing. Oh, yeah. One, let's go.
The day.
Oh no, you didn't just do that. No, you didn't. You did not do justice to that. No,
I just went opera.
There's no way I'm going to be a producer. No. Oh yeah, it's a happy day. So
exactly.
What do we have today?
Today is Wellness Wednesday. This is where we talk about health issues and what we can do to help it. Because health is like money. You have to not have one to value it most of the time because that's what people do. But on this program, we try to let us know what is happening in the society and the kind of things we should do.
Yes.
Because when some people hear some certain names of a particular disease, it's like death warrant.
Yes.
So
and at times it might be just the idea and mentality you have about the illness that takes your life very quick than the illness itself.
Yes. So that is why today we're talking about hepatitis. When you hear that word, most of the time, hey, the person is dead.
Even the sound of it is hepatitis.
All right, so that's why we have a doctor in the house to explain and tell us more about this particular ailment, because last week actually was Hepatitis Day. Yes. So that is why we're bringing in an expert to talk about it on today's episode of Tea or Coffee. We'll be right back, and when we come back, I hope you have your tea or coffee with you. All right.
Have a thrilling and bonding experience at High Impact Planet Amusement Park and Resort. Enjoy an amazing retreat in our extremely secured environment with our breathtaking rides. Set goals for the upcoming year in our convenient multi-purpose halls. Bond between team members while giving your staff a desirable treat. High Impact Planet. Fun just got real.
Welcome back. If you're just joining us, you're still tuned to Tea or Coffee on High Impact Television. Lest I forget, Happy New Month. It's new month, a new beginning, new resolutions.
That's the 8th month of the year.
Yes.
Welcome to the month of August.
Yes.
All right.
Okay, so we have our guest in the house already. He's Mr. Victor Ekong, a medical doctor.
Yes.
And also a volunteer for Pro Health International.
All right.
You're welcome, Mr.
Thank
Victor.
you very much.
Yes. So today we'll be talking about hepatitis. So what is hepatitis?
Okay, basically, like the word itself, hepatitis, it's just inflammation of the liver.
Okay.
We call the liver cells, major part of the liver cells, hepatocytes. So when the cells, for one reason or the other, it could be from viral infection, it could be from bacterial infection, it could also be from fungal, it could also be from excessive alcohol intake, it could also be from drug-induced, inflammation. And then the cells begins to swell up. Let me bring it down to the basic understanding. They begin to swell up, and then, we say hepatitis. So it now depends on the variant of hepatitis we want to talk about. Most commonly, we'll always look at the viral hepatitis because we can most times prevent them. And then they could be very easily transmitted from one person to the other. And unlike the drug-induced hepatitis, which is just going to be confined to just one person alone, the viral hepatitis, depending on the variants, like the B and the C and the D, and then those ones that have the blood or sexual, that could be transmitted through sexual intercourse, like the B and the C. Well, for the C, it's not really, it's neither here nor there, if it can be transmitted sexually. But most times from blood products, yes, they very much can be transmitted.
Can we start from the basics?
Yes.
We have hepatitis
Yes.
A, B, and C.
That's for the viral hepatitis.
For the viral, so we have more than that.
Yes, we do have more than that. That's when you want to talk about bacterial hepatitis, bacteria-induced hepatitis. Bacteria, yes, can also induce.
All right.
Don't forget, I said hepatitis is just basically inflammation of the liver cells.
Okay.
So depending on what causes it.
Okay.
Okay. But the common one is usually hepatitis A, B, or C.
That's for the viral.
Okay.
All right.
So alcohol as well can also induce hepatitis.
Okay.
All right.
Yes.
So will that be maybe for a point in time and then it goes back? Because hepatitis is inflammation.
Yes.
Of the...
Okay, now this is it. Now, whatever the cause of the hepatitis is, most times we always would want to manage depending on the cause. So if this person is having an alcohol-induced hepatitis, definitely in the line of management, you would obviously want to ask the person to stop, taking anything that has to do with alcohol. And then you would obviously want to reduce the amount of medications that have to be broken down or metabolized by the liver itself. So, but, most times we put our searchlight on the viral hepatitis because of its nature. Like the hepatitis B can be transmitted from mother to child. So most times we put our searchlight on it because we actually have vaccines for this, particular variant of hepatitis. So we could, vaccinate a large portion of, or a very large amount of the populace, and then tend to reduce the number of people coming down with, or the number of children that would have to live their whole life having hepatitis. And now this is the trick. Because the liver is a very vital organ in the body, it has to do with a lot of function, including metabolism of foods, carbohydrates, vitamins, lipids, and proteins. And then it also helps to clear out the drugs we take, also helps to absorb them, metabolize them. And then also play a role in how the blood functions, keep them, in the right state in the body. Because of the peculiar nature, if the cells tend to start failing, a lot of things will go bad. And then because of also the fact that the liver also helps in production of what we commonly would say bile. So there's a close relationship between the liver and then the gallbladder and then the pancreas and then the whole gastrointestinal system. And then not just that alone, when the liver is failing, obviously a lot of toxic that is supposed to be cleared or absorbed in the body won't be, appropriately channeled to the right position, to the right places to be cleared out. And hence, there will be a lot of toxicity. And then this person is going to come down looking, very septic. And obviously, this person is going to come down looking not good at all. Okay. It's going to distort the whole body system.
Okay. You mentioned causes and how to manage them. What are the major causes of hepatitis and how do you manage them?
Okay, like I would always say, The major causes of hepatitis. One, we have a viral hepatitis, which ranges from the hepatitis A, B, C, D, E. And some people are also of the school of thought.
F, G.
Yeah, I've seen in the text where they included G.
G.
Yes, but no F. I haven't seen the F. I don't know why. I don't know why, but I haven't seen the F. And then would have some bacteria that can actually cause hepatitis. Okay. And then we can also have, the fungal infections, certain types of fungus that can actually induce hepatitis. Okay. I use the word induce because, it can, in a way, cause the liver cells to start swelling or become inflamed. And then we now have a problem with, hepatitis-associated symptoms. Now, for the viral hepatitis, like for the viral hepatitis A, it's not sexually contacted. Usually, the route of infection is usually a fecal-oral. Fecal-oral meaning either from the mouth or from fecal matter. So most times, people drinking bad waters or poorly treated waters could contaminate the viral hepatitis A.
I've always had the mentality that bad water is just typhoid. So
exactly.
You mean it can also?
Yeah, that's why we say. That's why we say it's fecal oral. There are a lot of other fecal oral transmission of diseases aside from typhoid. Cholera is also a fecal oral. Fecal oral, what it means is that's the root. Just like we would have airborne infections, sexually transmitted infections, infections by contact. Yes. Yes. So that's just the peculiar nature of the viral hepatitis A and the E. They are both fecal oral.
Okay, but are they very dangerous?
Yes, they could be very fatal. Most times you see them in children a lot.
Children?
Yes, and then, the funny thing is they would always present the same way like most of our common causes of febrile illnesses in children, like your malaria. So most time you see a child come into the clinic with yellow eyes, fever, very high temperature, child is weak, vomiting and all, and then we start treating for malaria. Yes, obviously malaria can also cause that level of jaundice. Like people with yellow coloration, that's jaundice. But most times we fail to understand that could also be a viral hepatitis A. So when you don't check out, when you don't look out for it, you miss out on it. Okay. And then there's always what we call incubation period. So when you ingest it, the period at which it takes to manifest. Most times, most people would have it and probably go untreated, and then it remits. Okay. It has a period of remission, but most times it goes into a fatal state at which, they have symptoms, and then you have to manage.
Okay. All right, just as you mentioned that these symptoms can be similar. At times people could have the symptoms of typhoid, but then they think it's malaria because they have similar symptoms. So what are the early symptoms of hepatitis that would differentiate it so they don't mistake?
Yes. Well, I think for children, and then the peculiarity about viral hepatitis A is that most times it's usually more often occurs more in children, in childhood. Not that it doesn't occur in adults. It does occur in adults who most times in immunocompromised states, but in childhood you see it a lot. So jaundice is one thing you would always see. It's very marked. So when you do a malaria test and then it's negative, next thing that comes to your mind is what are the possible causes of jaundice in a child. So you want to rule out hepatitis as well. Most likely you'll be dealing with hepatitis A.
So if it's positive in the blood, right?
Yes.
How do you check by your blood, right?
But most times we routinely would not have, probably our scope of our environment would not give us the opportunity to do the ideal test to test for viral hepatitis A.
So what do we do in such a situation?
Well, but most times, when we have a good lab, when we have good laboratories, we usually would send the blood sample, of course. So they would check for the antibody and the presence of the viral hepatitis in the blood, and then the antibodies as well, and then from there we can manage. But the thing about viral hepatitis A, it's more like a symptomatic management, unlike our hepatitis B and then hepatitis C, where we have specific antiretrovirals that can actually help to manage and eradicate it. I've heard a lot of people saying hepatitis B has no cure. Hepatitis B has no cure. No, it's a wrong statement. Yes, hepatitis B can be managed and can be cured.
Really?
Yes.
Okay. Is that a new development, or it has always been?
I wouldn't say it's a new development, actually. It's just that most times we don't actually get to the right place. Most times. So, what most people do is they run the tests for viral hepatitis B or C. That's the one that is commonly done in our hospital with the strips, especially for pregnant women.
Yes.
It's one of the routines. So, they could give the child 30 minutes immediately after birth the vaccine to prevent,
child from contacting
yes,
it from
yes.
the mother.
And the peculiar thing about the viral hepatitis B is you could have the virus in your system, but it might not be doing the exact damage on the liver.
And just be redundant?
Yes, it could just be there. And then, actually, when it starts doing the actual damage, it could progress very fast.
All right.
Okay.
Yeah. And another thing about hepatitis is not just the hepatitis, but the complications that could be associated with it. Like I said, the liver is a very vital organ. So when these hepatocytes or liver cells start swelling up, a lot of functions they're supposed to do basically become deranged or become distorted. And so their close relationship with other organs in the body, the gallbladder, the pancreas, effectiveness is no longer guaranteed.
So out of the hepatitis that you've mentioned, which one is incurable?
Which is incurable?
Yes.
For some reasons, we dread the hepatitis C a lot.
Okay.
But despite that, I think new trend on management of hepatitis C has actually beamed a lot of positive outcomes on this particular variant of hepatitis. So you have to, it's not just about taking the medication, but you have to run series of tests to ensure that, these antibodies have been reduced to the barest minimum.
All right. Thank you very much. All right, we've been talking with Dr. Victor Ekong, and we'll be talking on the topic hepatitis. We'll go on a break now, and when we come back, we'll ask more questions, especially if it's very expensive to maintain or to treat. We'll be right back.
Walking into comfort in a safe environment is every family's dream. At High Impact Planet Resort, our fully furnished service apartment is a home away from home. Amazing views right in your luxurious world. Work out to keep fit for an amazing body at the gym. Get affordable groceries and personal care items at the supermarket. Feel relaxed and beautify yourself at the fully equipped spa. High Impact Planet. Fun just got real.
Welcome back. This is still Tea or Coffee, and we've been talking about hepatitis with Dr. Ekong from Pro Health International. Before we went on break, I said that we're going to ask if it is very, very expensive to treat.
Okay. Viral hepatitis A and E is not expensive. Viral hepatitis B is also not expensive. I've seen most patients that are HIV positive and then come down with hepatitis B. Yeah, most of the drugs actually has
Side effects?
no, not side effects. Yes, actually has a positive effect on the hepatitis B virus as well. Don't forget that these are all viral infections.
Okay.
Whether it's hepatitis, whether it's HIV, it's also a viral infection. So most of these antiretroviral HIV medications can actually...
so rather than have HIV, it comes down to hepatitis B.
No. That is, you're having both together.
Okay.
You understand? I'm just trying to give you an insight that it can be cheap because the antiretroviral given to HIV patients are actually free.
Okay.
So it can be...
So it can be used.
It can also be used. So in that state, it's cheap to manage. But
hepatitis patients, we have to buy theirs.
Yes.
Free.
Yeah, we can prescribe,
Okay.
the one for them to get on their own, but it's also not that expensive. But I think the problem there is in the management of hepatitis C.
Okay.
Okay.
Yes, in the management of hepatitis C, because about 6 serotypes, and then you have to, undergo further investigation, not just the hepatitis C test strip we do. So we have to undergo the, other immunological tests to be sure on which of the specific serotype of this hepatitis C, and from there, management can proceed. But I think the drugs are a bit expensive. Last I checked, well, they were over somewhere from 80,000, 100,000 upwards.
Wow.
For a course of a month, for a course of,
A month?
A month?
Yeah, yes.
80,000.
And
It even goes as much as 150,000.
Wow.
they need to use this for how many months?
I think you could treat for up to 6 months a year.
Hepatitis C seems to be the most dangerous
Yes.
one of them.
Okay, then you talked about hepatitis A. So what about the B and C? What are they?
The B and the C it's a viral infection. So that's a cause. Hepatitis B is a viral infection. Then the mode of transmission is blood through sexual intercourse as well.
For the B?
For the B.
Okay.
And for the C, through blood as well, blood products. So most times in the hospitals, when we have to transfuse a patient, we'd have to screen the patient for hepatitis B and C as well.
Okay.
Yes. So, and then through sexual intercourse as well, a lot of people would contact hepatitis B, unknown to them. And then the hepatitis D usually would not occur on its own, would always occur in association with hepatitis B. So there is an exposure to B already, then it's easy to pick up the hepatitis D. But it's not as common as it is. So most times we really don't remember that there's an hepatitis D or an E, because the most common of it all is the B's and the C's, and which is more peculiar to our environment because of, especially in certain age group that are sexually active, you want to do an hepatitis B or hepatitis C test, especially for pregnant women. You want to do a routine hepatitis B, surface antigen for hepatitis B, and you want to check also for hepatitis C because of the risks of transmission to the unborn child.
All right, so how can one protect oneself from contacting this?
Okay, protection from the hepatitis A to E. First, we have to remember that the A and the E are transmitted through the fecal-oral routes. So good hygiene, good sanitation is the primary prevention for it. And then obviously secondary prevention would now be to treat and then prevent further reoccurrence. Then that's just the basic.
Like, a lot of people say that even when one has been treated of this disease, it's always showing.
It always reoccurs. There's
No,
always
not even reoccurring. When they do the blood test, it will still show that it is in the system.
Okay,
That you might not.
because your body develops what we call antibodies to it.
Yes.
So most times, the body always, when you the test strip, what it shows is the antibodies. So when you run a test, so that's why most times we always will want to use more specific tests in the lab. But in a clinic setting where you just have to use a test strip, to hurriedly do a random or a rapid test. You won't be privy to all of that.
Okay, so it will still show as positive, though it's been cured.
If it's been cured, it always would show negative.
Okay.
Yes, except it's not been properly, cleared of the system. So that's why most times when people come to the clinic and then you run a rapid strip test, most times before placing them on treatment, most times we always want to send them for confirmation.
All right.
Okay.
So we don't treat
Still
an
on a
error.
question of avoiding prevention of hepatitis. How do you avoid getting in contact? Because you find out some people will tell you that no, he or she has hepatitis. I can't use a cup. I can't do this, so I don't contact
sit
it,
close.
which leads to stigmatization. So
Still on-
how do you avoid contact with?
Still on prevention, we also have vaccination. But unfortunately, the vaccines is not open or is not available for all the viral variants. So we have we have a vaccine for the A, we have for the B. Just two we really do have for them. And then for the D, the vaccine for the B can actually act as well. Can actually prefer immunity for the D, since you have to have a viral hepatitis B before you have a D in a lot of cases. So vaccination is one of the active way of staying out of hepatitis. But that's for the viral hepatitis.
Okay.
So you can be vaccinated and prevented from having a viral hepatitis depending on the variant at which your vaccine immunity covers for. But don't forget that if you're if you're a chronic alcoholic, there is still a chance of developing an alcohol-induced hepatitis.
Okay. Is it one in a lifetime immunization? Does it work when you like, for example, for children you have the HPV and all that? Will that work for them throughout their lifetime?
Yes, if you take the required dose. Yes, it actually confers lifelong immunity.
Okay.
Yes, that's for the viral, depending on the variant at which the vaccine is supposed to provide immunity for.
Okay.
So, but let's not get it wrong. Being vaccinated for hepatitis B or hepatitis C doesn't mean you cannot have hepatitis from other causes.
And it's as deadly as the other ones too.
Well, yes. That now depends on the stage, the level of severity. Just like I would always use malaria for examples because it was always common. So you can have, like right presently, what the Ministry of Health has said is we now have two types of malaria, either uncomplicated or severe. So for example, you could have malaria and then you don't come down with all the telltale signs of severe malaria like vomiting, anemia and all. So the same thing, you could have hepatitis from, be it alcohol-induced, even be it the hepatitis B, and then it might not be at a very severe level yet. So it might just be, at a very, an unsevere level at which those symptoms does not really weigh you down, and at which, most times we could give hepatoprotectors, drugs to help protect the liver cells, and then it could do the needful at that stage.
Oh, right.
Yes, but the truth is, in as much as we want to stay on prevention, it's cheaper, we should keep and stick to it, because hepatitis and the liver, we just have one liver in the body, unlike our lungs and our kidneys, at which we have two, so we can actually do away with one and survive on the other one. I actually lost a colleague in his final year for hepatitis.
Wow.
He was actually flown to India for a surgery. He had already developed liver cancer as well, but he didn't survive. He didn't make it out. So
it can be deadly.
It is.
he was supposed to be one of our best graduating students that year.
Wow.
So,
Okay, the vaccine that you're talking about, how many times? Is it once or 2 times or 3 times, to complete?
the dose for the vaccine.
Yes, the dose for the vaccine.
Actually 3.
3.
3 doses, yes.
Okay. Which is every day?
No, it's not supposed to be taken every day. You take the first one, the second one is about 2 weeks to 4 weeks apart, and then the last one is about 6 months' time. I think in 6 months' time you should be able to complete the entire dose, the 3 doses.
Okay, so is it possible that one person would have the different types of hepatitis, like only one person would have A, B, C, D, E, or one leads to the other?
Okay. If it's possible to have A and B, yes, it's possible.
A and B together?
Yes, it's possible.
Okay.
Wow.
Okay, now this is it. Depends on the level of immunity. So but it's very rare to just see a normal individual who his or her immunity is still very intact, having a different variant. Most times you see most of this, combined form of viral hepatitis in immunocompromised, especially in the HIV positive patients. So they could have the hepatitis B, and they could also have the hepatitis A, or they could even have both hepatitis B and hepatitis C.
Yeah.
Now, don't forget that most times these certain groups of people could also be, drug users. So they would share needles, injectables, and all. So the risk factors usually will be higher.
Okay.
So it's very, very much possible.
So the cost of treating maybe just hepatitis A alone, is it the same as treating both hepatitis A and B if you're having the two together?
It's definitely not going to be the same cost for treating both of them.
Okay, since it's the same hepatitis, so maybe
like malaria.
Yes,
Then you have headache, and you just use
one to clear the two of them.
No. But definitely anybody that's going to be coming down with both hepatitis B, hepatitis A and B is going to be coming down in a very critical condition. And obviously, you have to manage all the other things alongside.
Okay.
So if, for example, let me use a clear clinical case. If, for example, this is a drug user that's already tested positive to HIV, and it's coming down with hepatitis B, and it's also coming down with hepatitis A. Obviously, I won't rule out the fact that, and if this person is living around, within Nigeria, I won't rule out the fact that this person could also have some other form of, STIs that I should pay attention to, not necessarily viral infections or that possible, bacterial infections. This person could also come down with, tuberculosis, and it makes the management holistic, and not just you beaming your searchlight on hepatitis alone, but then you would have to manage other things. And then you have to manage adequately, and then depending on the critical state at which this person is coming.
Okay. So is it possible that maybe you used to have hepatitis A, and when you don't pay attention to it, it boils down to hepatitis B?
No.
Okay.
No. Hepatitis A is hepatitis A.
It's
Okay.
a different thing entirely.
It's an RNA virus. It cannot transmute itself. It cannot, it cannot change to be in hepatitis B. No. Hepatitis B is strictly going to be an hepatitis B.
So when does it get to a time that you realize that, oh, you have a patient and you know that this one, it's a no-no, it can't survive this? At what point do you?
Well, there's something that's peculiar in medicine. As doctors, we care, and doctor heals. So irrespective of the fact that we all have what we call prognosis. So for example, if I'm looking at a critical case, I should be able to draw a prognosis. And the prognosis tells me, okay, fine, this is about prognosis of about 70%, this person is going to survive it. If there's a prognosis of about 10 to 15 or 20, 30%, well, that goes a long way to say, well, the chances of losing this patient is as high as 70%, and the chances of this patient surviving is as low as 30%. But, amid all of this prognosis and all, we've seen patients that have good prognosis still not being able to pull out of whatever ailment they came up with. And then we've still seen, very few, although the margin is not that wide, it's very, very slim chances of coming out of it. So most times when you see most people coming down with, the telltale signs of hepatitis or end stage, hepatitis that is already transforming to liver cancer, it's as good as saying, well, let's just give this person life as much, or let's reduce the burden while he or she is alive. So what we want to do is try and give the best of care, try and give as much as supportive care we can give until if the person would eventually survive it or not. But these days they do liver transplants.
Okay.
It's just not common.
It's not just common. One, two, the chances as well of surviving and all. And then the cost. So how many people that would come down with, that level of liver failure and then would need a liver transplant, can actually afford it. So eventually you would come to see the fact that a lot of people are dying from, whatever cause of hepatitis, be it the viral hepatitis, alcohol-induced hepatitis, because of cost.
Okay, the vaccine here, imagine you have to take 3 to complete the dosage. What if after 2...
I knew you were going to come to that.
No, someone like me, I do not like medicine.
So it's like how people do. When you give them, take this for 7 days, 1 in the morning.
No,
one
it's
in the
injection.
evening.
It's actually
And
injection.
once you're
After 3
okay,
days,
within 3 days, and you feel you're good, you just leave the rest.
Yeah, so what happens in this case if after 3 takes, the person feels, after the second
the person
dosage,
feels like
the person feels,
it's
okay, I'm
good to
okay.
go.
Yes.
Okay, but I think the most appropriate thing to do is to complete the required amount of vaccine or dosage of vaccine, because it actually prefers immunity, like I said, a lifelong immunity. So the best thing is while try to boost your immune halfway and then stop. Okay? So I know a lot of people are in that habit.
The halfway will still work, right?
Well, it's a 50-50. It's a 50-50 thing.
Okay.
Okay. So why would you want to take the risks? Why not just complete, the immune? Why not just complete the vaccine and then be sure that you're 100% on the go?
Okay.
So whatever comes up, yes, you can beat your chest and be like, I'm good to go. I think presently I've heard, them trying to come up with a vaccine for HIV as well.
To cure HIV?
No.
Vaccine, nice.
Vaccine to prevent.
Okay, to prevent.
Nice.
So I'm pretty sure by the time that vaccine is out, everyone will go after it. Because hepatitis is no longer,
of course,
since they know that it can be cured. A lot of people are not really that scared of hepatitis.
Okay.
But people dread HIV a lot. You know,
Okay.
when you tell someone that has been engaging in, you know, unprotected sexual intercourse, do an HIV test. That fear is
The
always
fear,
there.
yes.
Even sometimes, even when you're not, you think, oh,
Oh.
I went to salon yesterday. The needle.
Yeah.
What if? Especially
You're
when you
prompted to go to the clinic and have yourself checked up, yes.
Exactly.
So who are those vulnerable to hepatitis? What age brackets? Who are those vulnerable
Okay.
to hepatitis?
Okay, so I would have to go back to the okay. Those that are most vulnerable, depending on the type,
Okay.
in short, irrespective of the type, usually drug addicts,
Okay.
immunocompromised patients, those that are HIV positive, or those that are, you know, immunocompromised to whatever cause. Okay, but most times we always use HIV because it's one of, you know, the common cause of immunocompromised. But that's not just the only immunocompromised states we have. We should bear in mind as well. You know, and then sexually active individuals, those that are within that age, you know, also at high risk of having hepatitis.
Okay.
Because a lot of unprotected sexual intercourse would also, and then health workers are also at risk.
Health workers.
Yes. We are also at risk because treating an hepatitis patient and then you're not using the standard technique for safety measures.
Okay.
Obviously, you're also at risk of contacting it. Just like the case of Ebola.
Yes.
Okay.
Health workers were at the forefront.
Yes.
So that's why we had to beef up the safety technique at that point in every hospital, you know, to reduce the number of health workers being exposed.
All right. Thank you very much. Quickly, what do you have to tell people that are maybe infected and are scared already, or that maybe their loved ones
Or people that are even doing
infected.
one or two things that could lead to hepatitis, like
Yes.
drinking.
and all that? So quickly, what do you say? So
Okay,
that we'll wrap
this is it. If for one reason or the other, anybody thinks he or she could be having hepatitis, the viral hepatitis variant, or he or she has been exposed to, nothing stops the person from walking into the hospital, see a physician, get consulted appropriately. The physician would know what to do from there.
All right.
See a doctor. Don't forget to see a doctor. That's just the basic of advice I
Don't
would give.
forget to see a doctor.
doctor.
All right. If you know you've been exposed to this, or you believe that you're feeling kind of, you know, not see, what's it called? Dizziness is part
Yes.
of the symptoms.
Symptoms.
Yes, symptoms, dizziness,
Yellow
fever,
eyes.
headache.
Yellow eyes, loss of appetite.
Yes, loss of appetite comes
All
as
right.
well.
But
But once you
some of the
notice,
symptoms similar with
once you notice, I mean, yellow coloration of the eyes, of the palms.
Okay.
Don't wait for any other minute or any
Okay.
other second.
All right.
Okay.
Get to the hospital as soon
When
as
you
possible.
notice the coloration of the palm, the eyes, do not wait to run to the doctor right now, because good news, it can be cured.
Yes.
Thank you very much for coming, Dr. Victor Ekong. Dr. Victor Ekong is a volunteer for Pro Health International, and he's been enlightening us on the topic hepatitis. Till tomorrow when we come your way, keep shining, keep smiling, keep living the good life, and be at the positive side of life. I'm Ronke Ashiru.
And I am Wura Olakpokmola.
Bye.
Bye.